A very good afternoon to you. On the business desk at this hour, we carry on with that reaction of the signing into law of the NHI bill because private medical aid schemes are not satisfied with this. Metropolitan Health has added its reaction to the medical aid sector's criticism of that NHI bill. The company's Damien McHugh speaks to us about their stance. Thank you so much for your time, Damien. I think let's start here. Your initial reaction to the move that President Cyril Ramaphosa has just made.
I think, firstly, I'm not surprised by the signing of the bill. We've been expecting it for some time. And also don't necessarily view it as a negative for our country. We've got some serious inequalities in our healthcare system, and we understand that we need to readdress them if we want a healthcare system which is better for all South Africans. Both in money that we spend in the two sectors and the provision of healthcare and the delivery of healthcare in both sectors, there's a lot of inequality. So we have no issue with trying to address the inequality that exists within a South African context. What we really want to make sure of, though, is when we address it, we do it with the right way, that the outcomes in our South African healthcare system become better, the quality of healthcare that all South Africans will have will be improved, and the accessibility to that healthcare will also be improved. So do we back a national healthcare system in South Africa? Absolutely we do. But we do believe that there are mechanisms and ways that we can do it collaboratively, and I think the President spoke about that quite at length, is the collaboration between the public and private sectors needs to be the way in which we build a healthcare sector which is sustainable for us going forward. We cannot afford, as South Africa, we cannot afford a system where we pay more and we get worse outcomes, or we pay a hang of a lot more to marginally improve outcomes. What we really need to do is be able to hopefully pay less and improve healthcare outcomes for our people. It's a critical part of health. We believe in that your health is your wealth, and so if we don't have an economy which has got healthy people in it, we won't be able to grow our GDP and grow our economy going forward. So it's a critical step for us, but we do believe there are ways that we can work collaboratively with the public sector to improve it.
Moving on from this particular point, which are those ways that the private sector is going to seek to work with government? There's already threats from other entities of litigation in this regard, where the argument is that in its current form, NHI in South Africa does not meet constitutional muster. Where do you stand?
I think on the constitutional muster, I'll leave that to the legal people. I think we would rather look at ways to see how we can collaborate to make it better. And I think there are ways. I think in the process of the skill sets that we've built as a private industry, both in the provision, in other words, through the doctors and hospital groupings, we deliver, as if you compare it internationally, our private sector delivers some of the best quality outcomes at some of the cheapest prices compared to around the world. So how do we help make sure that those elements are transferred into a national healthcare system? We administer, as very many private industry or private medical schemes like ourselves, private administrators, thousands, well, billions actually, of transactions every single month. And how do we help a system set up? What are the system requirements that are needed? Looking for fraud, waste, abuse, those types of things we need to try and get out of a national healthcare systems because it's going to be paid with taxes. How do we make sure that we don't have abuse in the system? And I don't mean that by looting and things like that. I mean that by abuse, people going to, get a second pair of glasses when they don't need, or having teeth extracted when they've already been extracted. It's that sort of stuff that in a healthcare system happens quite a lot. And we think we've got systems to help with that. I also think in the phased-in approach of this, how do we create more money for government? And one of the things that we think we can do is there are a lot of people who are employed in South Africa who are not covered by any form of health insurance. If we can move some of that burden initially from state into the private sector, what that does is it enables the government money to be spread across fewer people, and hence per capita, the spending that they have becomes larger. So there are steps as well in the implementation phase that we think we can help with too.
So your immediate reaction is not going to be that of challenging the signing into law of NHI?
I think we need to highlight the challenge. It just doesn't mean that we are critical of the whole process. I think there are things that we think we can help improve. And that criticism isn't meant as negative. It's meant as how do we work together to try and make the system better. And I think that's the spirit with which we are looking at it. We think it's a positive, it's a step. Now, some people say it's positive, some people say it's negative, some people say it's a big step, some people say it's a small step. Let's just say it's a step. And it's a step to try and get more people access to better healthcare. How do we help make that a reality for the benefit of South Africa? And I think we can help if we work together.
As a parting shot, the timelines that have been set are not particularly clear, and experts have already opined that the implementation of NHI, despite the big move that was taken today, may take years in South Africa. Are you optimistic that that is going to give both private and state the time needed to ensure that there is the much required collaboration?
I do think it's going to take time. I think as you unwind the current system and you want to build a new one, if you do that hastily, I think you create potential challenges for yourself or unintended consequences. And we need to try and prevent that. And again, I think if we work together and use the insights from both sectors, we'll be able to get that. We'll be able to get that right. I also think it's important for us to understand that because the bill is signed today doesn't mean that national health is available tomorrow. And therefore, consumers should be aware of the fact that they still need to belong to private medical schemes in the interim. Other consumers who don't have access to healthcare, they can't just walk into a private facility and get healthcare covered in full from tomorrow. So it's going to take time for these initiatives to embed in our economy, and it will take time for, and particularly if there's legal action and so on, those processes may take some time through the courts. It's going to take time for it to be implemented. And in that time, let's not panic. Let's remain calm, and let's continue doing what we're doing, and let's collaborate to make sure that it's implementable in a way that is sustainable for South Africa.
Thank you for that balanced view. That is Damien McHugh from Momentum Metropolitan giving us that reaction to the private medical aid sector towards the signing into law of the NHI bill.